So successful, the medical university at Graz, section ophthalmology, has done a vast research. And the professor there has been completely taken back by the wonderful results we get of Akshitarpana, just with normal ghee, without any medication in it. And the study has been so successful. And he told in a lecture that just the tear liquids has so far, one has been able to isolate 493 different fatty acids. So there is no medical substance whatsoever that can substitute it. And the effects we had from using the ghee is simply so overwhelming that nowadays in every pharmacy in the area of Graz, you can buy a bottle of ghee, and with some little how you say? Augenbadewanne.
Sort of a device that
It's
you can bath your eyes in ghee.
And it's recommended to do it daily. And they found significant better results in Akshitarpana with ghee than with any other medication they had in the medical university.
So just in brief, because I don't know whether everyone here is aware of what the Akshitarpana is and what would be the general treatment of dry eye. Could you just explain it in brief? What you do when you treat dry eyes with Akshitarpana?
So the patient can do it in that system alone. He just has to warm the ghee so it's liquid, but he has to be very careful not to make it too hot. It should only have about 26 degrees. And then he fills one of these little glass bathtubs with the ghee, and he puts it to the eye, and he puts his head back, and he leaves it about 6 to 8 minutes on the eye. And then he does the same procedure with the other eye. And we recommend that they do it one eye at a time because they're alone. They're not under medical supervision. Okay. So in case they get some blurred vision, they won't be banging their head on the ceiling or somewhere else. So there will not be any accidents from that point of view. And even a more simple method is that I recommend my patient at night to put some ghee on the finger and take the lid down and just smear it on the lower lid. And then don't read any books or don't watch TV, but just go to sleep. And that is like the mini version or the daily version that they can be doing. And of course, in therapy, we make it more elaborate so that we do some purva karma and then even preparing the whole face and then making with dough some kind of glasses. I already tried different, like we are using for skiing, the mask they're using for skiing. And I put that, I thought, why every time I have to build such a dough, spectacles. But then after 2 treatments, the ghee or the medicated ghee is so strong that all the plastic around the glasses was destroyed. So that and I used the swimming glasses, like the glasses they use for swimming. They didn't also not work because immediately the rubber on that was disintegrated. Yeah.
Okay.
So you have to do it with dough, and chickpea flour is always a little problem because we may have some allergic reaction. We have a lot of people here in Europe around the eyes. Maybe they have neurodermitis or they don't have, but they will develop some reaction which can be very severe. So I'm mixing it with the urad dal. Or if they're allergic, I just try to make it completely like in Kerala. They use urad dal, and in North India they use the chickpea flour.
So already quite detailed, but thanks for that, Hans. So that would be your choice. If and maybe what about you, Manjusha? Is there any specific condition where you feel that you got the clue for?
We are doing Tarpana for refractive errors, that is particularly myopia and presbyopia. Then retinitis pigmentosa, RP. Then this open angle glaucoma patients, where even if after putting anti-glaucoma drugs, IOP is not coming under control.
So glaucoma would be one condition that you like to treat?
Open angle glaucoma. We have tried to measure after the giving Tarpana, BT and AT, like before Tarpana, when we measure the IOP. In normal persons, there is not much lowering of IOP. But the persons who are having raised IOP, their 3 to 5 mm of IOP comes down. Mm of mercury, intraocular pressure comes down.
I think, Manjusha, you in Germany, people are not very well acquainted with the abbreviations. So maybe maybe take it a little slower so we can all follow you. All right.
Okay. And I'm very amazed to the way Dr. Hanley has explained the use of Tarpana. He has used Grita, but in the text, Grita Manda is told that supernatant clear fluid, when we keep the cow's ghee, just after liquefying it to stagnate, it will divide into 2 sectors. One is very clear and the other is larger globules of fat. So clear or separate that supernatant part, that is known as Gritamanda, and that will be more wonderful for Tarpana in dry eye syndrome. That is our experience. And if a person cannot undergo Tarpana, you can use it as an eye drop form as the frequency like you use the artificial tears. They will work better than artificial tears.
So suppose, a pre-diagnosed case of open-angle glaucoma walks into your Ayurveda ENT OPD. What would be a regular treatment scheme?
We are giving first local Shodhana. We are doing Seka in the eye. Then only we are going for Tarpana. That is one part. Another, we are giving internal Mutral Aushadhi. Hypertension and the raised intraocular pressure has got relation. That the 10% of the hypertensive patients, they are prone to get raised intraocular pressure or the glaucoma. So this anti or the diuretic therapy helps to decrease the intraocular pressure in the glaucoma patients. And Shodha Chikitsa or anti-inflammatory drugs, I am very fond of using Chandra Prabhavati, again which is a combination. Very good to reduce the inflammation and very good diuretic. And I am getting wonderful results with Chandra Prabhavati in those patients.
So, pretending that I don't know anything about Ayurveda, suppose, I have a glaucoma and I walk into your office. What do I have to expect in terms of length of the treatment and the number of Tarpana sessions? I mean, what do I have to expect over the course of the next weeks and months? How often do I have to walk into your office? Do I have to stay in the hospital? Can I go home?
See, for working people, we are doing as OPD procedures. Either morning or in the evening is the ideal time for doing Tarpana. So, for maximum we are doing from 5 to 7 days of one course of Tarpana. Then after 7 to 10 days we repeat. So, if we are doing Tarpana course, so 7 days or at the most, as for any Panchakarma or any Shodhana procedure, it is told double the time should be the gap between the 2 procedures of the actual treatment procedure. So, if you are doing 5 days Tarpana, we can give the gap of 10 days. And again we can repeat the Tarpana. And internal medication we can continue. And we can ask them, once the IOP comes under control, then we can ask them to come for follow-up after 15 days or month. And that all depends on the chronicity of the disease or how much pressure is raised. That will vary again from patient to patient.
Great. I thought it was very interesting and also complicated. Did you all get that? Is there any question from the audience relating to what Manjusha Rajagopala just said?
Yeah, I didn't understand
the Shika procedure, the cleansing, the Shodhana procedure by Shika. Maybe you can say a word to that.
Seka is, in ocular therapeutic procedures, we have 5 basic procedures. One is Ashyotana first, then Seka, then third is Anjan, then Tarpana and Putpaka. This is the sequence. Ashyotana is done as a very first procedure in any acute condition. Any acute condition like conjunctivitis iritis, iridocyclitis, or inflammation of anterior segment, you can say, starting from lid margin up to ciliary body. Any inflammatory condition, first you can start with Ashyotana. If the aggravation of dosha is more, then you can go for Seka. Seka is you have to make a decoction. Like if you take 5 gram of trifla powder, suppose for an example, take 100 ml of water, boil it up for 5 minutes or so, bring it to the temperature which is lukewarm, and ask the patient to lie down in supine position, and patient has to close the eyes, and we have to put from height of 4 fingers from a small container. You must have seen in temples in India, that is for putting Abhisheka onto the Shivlinga, Lord Shiva. So that type of container is there. So we put like a continuous stream onto the closed eye. This is very much helpful to bring down the pain in conjunctivitis or even in trauma, corneal ulcer, all such conditions. You can immediately bring down the pain without use of any painkiller. This I can say with my experience.
Does that answer your question? I think there was another question somewhere there. No? Then Nambi ji, where does Ayurveda work miraculously for you in terms of ENT treatment?
For me, as a general practitioner, it is very successful for me to handle an allergic rhinitis, especially in the children. Nowadays, they quite oftenly they come with sneezing in the early morning. Very frequently, secretions come from the nose, and they are really discomfortable with that. And what I do is a very simple prescription that I tell them to take amalaki, a small amount every day. Very successfully, if you take amalaki every day, a small amount, maybe I prescribe like 2 to 3 grams every day, they feel very comfortable in a 15-20 days. If they want to have an immediate result, in Kerala practice, we use a decoction called Vyakriyadi. It's containing only 3 drugs. One is Vyakri, one is ginger, and Gutuchi. Again, Gutuchi has a Tinospora cardifolia. It is also having wonderful result. So I prescribe this. It is readily available in the market, and tell to consume this medicine continuously in 2 to 3 days. Immediately their secretions come down, and they'll be really easy to have that. But again, I usually prescribe, I'll ask the children to continue amalaki, because as you know that it can have many added advantages besides this problem.
That sounds very simple. I really like that idea. So I mean, you just go for amalaki alone, like churna or chavanprash, or what kind of
amalaki churna. Amalaki churna. It's wonderful. But only thing that depends upon the age, you have to prescribe the doses about the Agni. Because when you prescribe Amalaki Churna, it has slight anuloma or downward movement tendency. So if the child feels, if they are already little bit loose bowel person, he may have a tendency to have more bowel movement. So you have to reduce the dosage, or you have to mix that Amalaki powder with honey, so that his anuloma tendency will be controlled.
So you'd say 2 to 3 grams amalaki churna
perfectly
as a permanent treatment?
Definitely. It have wonderful results in clinical practice.
Only throughout the allergic rhinitis season, or throughout the whole year?
No, I normally prescribe for a short period and tell them to stop after a month, because I don't want to child to continue to have this. But normally they will get wonderful results.